Question 1. A pregnant patient at 30 weeks gestation is diagnosed with placenta previa. What is the priority nursing intervention? A. Prepare the patient for immediate delivery. B. Instruct the patient on pelvic rest. C. Encourage ambulation to improve circulation. D. Perform a vaginal examination to assess bleeding. Answer: B. Instruct the patient on pelvic rest. Question 2. A nurse is caring for a patient with complete placenta previa who is experiencing active bleeding. What is the nurse's first action? A. Administer tocolytics to stop contractions. B. Monitor fetal heart rate and maternal vital signs. C. Prepare for an emergency cesarean section. D. Perform a digital vaginal examination. Answer: B. Monitor fetal heart rate and maternal vital signs. Question 3. Which assessment finding is most concerning in a patient with placenta previa? A. Painless, bright red vaginal bleeding. B. Fetal heart rate of 140 beats per minute. C. Mild uterine contractions. D. Reports of fetal movement. Answer: A. Painless, bright red vaginal bleeding. Question 4. A patient with suspected placenta previa arrives at the emergency department with vaginal bleeding. What diagnostic test is most appropriate to confirm the diagnosis? A. Transvaginal ultrasound. B. Pelvic MRI. C. Amniocentesis. D. Digital pelvic examination. Answer: A. Transvaginal ultrasound. Question 5. The nurse is reviewing the care plan for a patient with placenta previa at 34 weeks. Which action requires intervention? A. Keeping the patient on bed rest. B. Administering corticosteroids to enhance fetal lung maturity. C. Monitoring for signs of preterm labor. D. Encouraging vaginal delivery if bleeding stops. Answer: D. Encouraging vaginal delivery if bleeding stops. Question 6. A nurse is delegating care tasks for a stable patient with placenta previa. Which task can be safely assigned to a licensed practical nurse? LPN. A. Administering IV magnesium sulfate. B. Performing a sterile vaginal examination. C. Monitoring maternal vital signs. D. Educating the patient on placenta previa complications. Answer: C. Monitoring maternal vital signs. Question 7. A patient at 36 weeks with placenta previa asks why a vaginal delivery is not recommended. What is the best response? A. Vaginal delivery is possible with close monitoring. B. The placenta may obstruct the birth canal, leading to hemorrhage. C. A cesarean section is only needed if labor progresses quickly. D. Vaginal exams can help determine if vaginal birth is possible. Answer: B. The placenta may obstruct the birth canal, leading to hemorrhage. Question 8. Which symptom requires immediate medical attention in a patient with placenta previa? A. Mild cramping without bleeding. B. Spotting after intercourse. C. Sudden onset of heavy vaginal bleeding. D. Occasional fetal hiccups. Answer: C. Sudden onset of heavy vaginal bleeding. Question 9. A nurse is teaching a pregnant patient about home care for placenta previa. Which statement indicates correct understanding? A. I should avoid sexual activity and strenuous exercise. B. I can take a daily aspirin to reduce clot risk. C. I should monitor fetal heart rate at home. D. I should perform Kegel exercises daily. Answer: A. I should avoid sexual activity and strenuous exercise. Question 10. Which factor increases the risk of placenta previa? A. History of cesarean delivery. B. Maternal age below 20. C. Low pre-pregnancy BMI. D. First-time pregnancy. Answer: A. History of cesarean delivery. Question 11. A nurse is assessing a patient with placenta previa who is being prepared for cesarean section. Which findings should be reported immediately? A. Hemoglobin level of 11 grams per deciliter. B. Fetal heart rate of 90 beats per minute. C. Patient reports anxiety about surgery. D. Uterine fundal height of 34 centimeters at 36 weeks. Answer: B. Fetal heart rate of 90 beats per minute. Question 12. A patient at 32 weeks with placenta previa asks why a C-section might be planned at 37 weeks. What is the best explanation? A. To prevent preterm labor complications. B. To avoid the risk of heavy bleeding during labor. C. Because the baby is too small to be delivered vaginally. D. A C-section is always needed for all pregnancies with placenta previa. Answer: B. To avoid the risk of heavy bleeding during labor. Question 13. Which assessment finding is expected in placenta previa? A. Firm, board-like abdomen. B. Painless vaginal bleeding. C. Severe back pain. D. Elevated maternal blood pressure. Answer: B. Painless vaginal bleeding. Question 14. A nurse is preparing a patient with placenta previa for a scheduled cesarean section. Which action is most important? A. Teaching the patient deep breathing exercises. B. Ensuring 2 large bore IV lines are in place. C. Administering an enema for bowel clearance. D. Encouraging the patient to walk before surgery. Answer: B. Ensuring 2 large bore IV lines are in place. Question 15. Which action should the nurse avoid in a patient with suspected placenta previa? A. Monitoring fetal heart tones. B. Preparing for possible blood transfusion. C. Performing a vaginal examination. D. Assessing maternal vital signs. Answer: C. Performing a vaginal examination. Question 16. A pregnant patient with placenta previa asks how it will affect her baby. What is the correct response? A. Your baby will need to be delivered via C-section. B. The placenta will move up, allowing for vaginal delivery. C. Your baby is at no risk from placenta previa. D. You should expect a vaginal birth if labor starts naturally. Answer: A. Your baby will need to be delivered via C-section. Question 17. A nurse caring for a patient with placenta previa notes an increasing amount of bright red vaginal bleeding. What is the priority action? A. Place the patient in Trendelenburg position. B. Notify the provider immediately. C. Encourage fluid intake. D. Administer oxytocin to slow bleeding. Answer: B. Notify the provider immediately. Question 18. A patient at 35 weeks with placenta previa is admitted for monitoring. Which symptom requires urgent intervention? A. Mild occasional contractions. B. Fetal heart rate of 150 beats per minute. C. Heavy vaginal bleeding. D. Complaints of mild nausea. Answer: C. Heavy vaginal bleeding. Question 19. A nurse is reviewing risk factors for placenta previa. Which patient is at highest risk? A. A 24-year-old with a first pregnancy. B. A 30-year-old with a history of 3 cesarean sections. C. A 26-year-old with a normal BMI. D. A 28-year-old with no prior pregnancies. Answer: B. A 30-year-old with a history of 3 cesarean sections. Question 20. What is a key complication associated with placenta previa? A. Uterine rupture. B. Hemorrhage. C. Gestational hypertension. D. Neonatal jaundice. Answer: B. Hemorrhage. Question 21. Which of the following is a contraindication for patients with placenta previa? A. Administration of corticosteroids. B. Continuous fetal heart rate monitoring. C. Digital vaginal examination. D. Planned cesarean section. Answer: C. Digital vaginal examination. Question 22. A patient at 29 weeks with placenta previa is stable but has intermittent spotting. What is the most appropriate plan? A. Admit for emergency cesarean section. B. Encourage increased activity and ambulation. C. Maintain pelvic rest and monitor bleeding. D. Perform an immediate vaginal exam. Answer: C. Maintain pelvic rest and monitor bleeding. Question 23. Which assessment finding in a patient with placenta previa at 36 weeks requires urgent intervention? A. Hemoglobin level of 12 grams per deciliter. B. Fetal heart rate of 100 beats per minute. C. Mild lower back pain. D. No fetal movement in 20 minutes. Answer: B. Fetal heart rate of 100 beats per minute. Question 24. A patient with placenta previa at 35 weeks reports a gush of bright red blood but denies pain. What is the nurse's priority action? A. Assess fetal heart rate and maternal vitals. B. Encourage oral fluid intake. C. Perform a fundal massage. D. Check for cervical dilation. Answer: A. Assess fetal heart rate and maternal vitals. Question 25. A nurse is educating a patient with placenta previa about activity restrictions. Which statement by the patient indicates correct understanding? A. I can go for short walks, but must avoid lifting heavy objects. B. I should avoid all physical activity until delivery. C. I can continue normal activities if I do not have pain. D. I should perform deep squats to promote circulation. Answer: A. I can go for short walks but must avoid lifting heavy objects. Question 26. A patient with placenta previa at 34 weeks is on bed rest. Which intervention is most important to prevent complications? A. Encourage frequent repositioning. B. Provide high-dose iron supplements. C. Administer diuretics to prevent fluid retention. D. Encourage the patient to lie flat on the back. Answer: A. Encourage frequent repositioning. Question 27. A nurse is caring for a pregnant patient with placenta previa who has mild bleeding. What intervention is inappropriate? A. Monitoring fetal movement. B. Administering ROGAM for Rh-negative patients. C. Providing reassurance and education. D. Encouraging a high-fiber diet to prevent constipation. Answer: D. Encouraging a high-fiber diet to prevent constipation. Question 28. A patient with placenta previa at 37 weeks is being prepared for a scheduled cesarean section. Which preoperative order should the nurse question? A. Administering IV fluids. B. Obtaining blood type and cross-match. C. Performing a vaginal examination. D. Placing an indwelling urinary catheter. Answer: C. Performing a vaginal examination. Question 29. Which patient with placenta previa is at highest risk for complications? A. A patient at 32 weeks with occasional spotting. B. A patient at 36 weeks with heavy persistent bleeding. C. A patient at 30 weeks with no symptoms. D. A patient at 28 weeks with a posterior placenta. Answer: B. A patient at 36 weeks with heavy persistent bleeding. Question 30. The nurse is assessing a patient with placenta previa who is undergoing continuous fetal monitoring. Which finding is most concerning? A. Fetal heart rate of 160 beats per minute. B. Absence of fetal accelerations. C. Moderate variability in fetal heart rate. D. Irregular fetal movement. Answer: B. Absence of fetal accelerations. Question 31. A patient with complete placenta previa at 34 weeks asks why a C-section is necessary. What is the best response? A. The placenta may block the birth canal, causing severe bleeding. B. Your baby will be too large to be delivered vaginally. C. A vaginal birth could cause fetal distress but may still be attempted. D. A vaginal birth is possible if the placenta moves before labor. Answer: A. The placenta may block the birth canal, causing severe bleeding. Question 32. A nurse is reviewing lab results for a patient with placenta previa. Which result is most concerning? A. Platelet count of 95,000 per millimeter cubed. B. Hemoglobin of 13 grams per deciliter. C. White blood cell count of 9,000 per cubic millimeter. D. Blood glucose of 100 milligrams per deciliter. Answer: A. Platelet count of 95,000 per cubic millimeter. Question 33. A nurse is providing discharge teaching for a patient with placenta previa. Which statement requires further teaching? A. I should call my provider if I notice vaginal bleeding. B. I should avoid intercourse and tampon use. C. I can continue moderate exercise if I feel well. D. I should report any decrease in fetal movement. Answer: C. I can continue moderate exercise if I feel well. Question 34. What is a primary maternal complication of placenta previa? A. Hypertension. B. Hemorrhage. C. Eclampsia. D. Urinary tract infection. Answer: B. Hemorrhage. Question 35. A patient at 33 weeks with placenta previa is being monitored in the hospital. What assessment finding requires immediate intervention? A. Mild ankle edema. B. Shortness of breath and low oxygen saturation. C. Occasional fetal hiccups. D. Fundal height measuring 33 centimeters. Answer: B. Shortness of breath and low oxygen saturation. Question 36. A nurse is caring for a patient with placenta previa who is on bed rest. What is an important nursing intervention? A. Encourage hourly ambulation. B. Provide DVT prophylaxis as ordered. C. Administer high-dose vitamin D. Apply abdominal binders to support the uterus. Answer. B. Provide DVT prophylaxis as ordered. Question 37. A patient with placenta previa at 35 weeks reports increased vaginal bleeding. The nurse should prepare for which intervention? A. Administering oxytocin to control bleeding. B. Preparing for an emergency C-section. C. Encouraging bed rest until bleeding stops. D. Performing a vaginal examination to assess dilation. Answer. B. Preparing for an emergency C-section. Question 38. The nurse is caring for a patient with placenta previa and notes tachycardia and hypotension. What is the most likely cause? A. Hyperemesis gravidarum. B. Developing hypovolemic shock from blood loss. C. Maternal anxiety. D. Normal cardiovascular adaptation in pregnancy. Answer. B. Developing hypovolemic shock from blood loss. Question 39. What is a key nursing priority for a patient with placenta previa in the third trimester? A. Performing frequent vaginal exams. B. Administering NSAIDs for pain management. C. Monitoring for signs of preterm labor. D. Encouraging a low-carbohydrate diet. Answer. C. Monitoring for signs of preterm labor. Question 40. A patient at 36 weeks with placenta previa is scheduled for a C-section. Which preoperative assessment findings should be reported immediately? A. Platelet count of 110,000 per millimeter cubed. Blood pressure of 110 over 70 millimeters of mercury. C. Complaints of a mild headache. D. Fetal movement within normal limits. Answer. A. Platelet count of 110,000 per millimeter cubed.
If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.